Hi everybody, happy Friday. Dr. Ash here again. Today's video, I wanted to talk to you about how to study in nursing school. With over 20 years of experience in nursing, I've made it my personal mission to see every student succeed. That's right, I want you to succeed. So I'm coming at you live today to talk about how to study in school. With the new semester starting, I'd really like to just set you up for success and be done with it, okay? I've got some notes here because I've got some really good information that I want to make sure that I share with you guys. So let's talk how to study in school. I've heard some people say that this is only applicable or it only applies to med-surg, and that's simply not true, guys. You can use this method to learn anything you need to know in nursing school. Hypertension all the way down to schizophrenia and any other disorders in between. All right, so the first thing that I want to talk about is stop reading every single word in your book. Okay, you do not need to waste valuable time reading every single word in your nursing books. Like, you just don't need to do that, okay? And I know you're thinking, but I spent so much money on my nursing books. Yes, they are a good frame of reference. Hey Karen, welcome. They are a wonderful frame of reference, but here's the thing, like, especially if you read with a highlighter and you highlight every single word, what was the point? You thought every single word was important in that chapter? And there are some really good information that they give to you in your book, but there's a lot of filler words too, and you simply don't need to read every single word. In fact, I can actually teach you how to outline your chapters. That's how I did it over 20 years ago, and look at me here killing it today. All right, so let's get to how to best study in school. The best thing to do is to start by learning your pathophysiology. Patho what? Pathophysiology, okay? This is literally the process that causes, it's a result from, or it's associated with a specific disease, okay? We commonly call it patho. There's a lot of students and faculty, nurses, we tend to call it patho for short because it is a very long word. So this is how the disease alters normal processes within the body or within the body system. Patho is the foundation for every single condition, like I said, from hypertension to schizophrenia to diabetes. Like, if you know patho, you can do anything. All right, it's important for many different reasons, but mainly because memorizing in school is not going to make you successful, okay? Nursing tests, the NCLEX at the end of all of this, they require you to apply your knowledge, which means you have to go a step beyond memorization. Now, memorization is fantastic for remembering when to show up for your test. Yay, you showed up for your test. But you have to be able to apply what you've memorized to an actual condition, to a patient situation, all of the above. And again, this is not just for your nursing test, but also for your NCLEX, right? What's the point of nursing school if you don't take your licensing boards? So it is really the foundation to help you be successful. Nursing is about the application of knowledge, so learning patho is going to make you very, very successful. Once you learn patho on any disease, you'll know exactly how that disease or condition works in the body. You can answer nearly any question that's thrown to you about that disease, and that right there, my loves, is pure gold, okay? Being able to answer those test questions. But it doesn't stop there, okay? Now that we have the patho down for the disease, the next thing you want to do is write down the common signs and symptoms, or what's known as assessment findings, that are associated with this specific condition that you're looking for. So once you match up the symptoms, you know what you can expect to find in your patients, okay? This will also help you visualize in your mind, okay, what this looks like in a clinical setting with real life patients. That is some more gold for you, because here you go. As you're taking your test, you can pull in what you saw in clinical, you can pull in the things that you know about the disease process, and boom, You get to answer some more questions, okay? So patho and then common signs and symptoms or assessment findings will help you nail down any condition. The last part of this, which is kind of like the gravy or the icing on top of the cake, is you want to write down any diagnostic procedures, any labs that are associated with this condition. In other words, these are procedures and labs that will either diagnose a disorder or they're associated or a result of that disease process. So an example, in order to diagnose hypothyroidism, which means my thyroid gland is not functioning like it's supposed to, there's lab work where we draw thyroid hormones. So that lab work would be associated with hypothyroidism, and that would be something that you want to write down in order to study for hypothyroidism. Another example would be like to diagnose pneumonia, you would need a chest x-ray. That's a diagnostic procedure that tells us the patient, in fact, has pneumonia. Okay? In this last part of how to best study in nursing school, we have these things called nursing interventions. And those are things that I can do as a nurse independently or in conjunction with another discipline, physical therapy, occupational therapy, lots of disciplines to choose from, especially in the acute care setting. These are things that I can do for my patient to improve their outcomes or that are specifically associated with the disease and condition. Let's use high blood pressure or hypertension for an example. As a nurse, I know that it's part of my job to assess their vital signs. I want to know heart rate and I want to know blood pressure. Other things that I may want to add into that nursing intervention section would be like daily weights. Patients who retain fluid will have swelling, but they will also gain weight. So that's a part of nursing interventions for hypertension. So I don't want to take up too much of your time. I just wanted to put that out there. This is the best way to learn, and I promise you, you don't have to get wrapped up in all the details. If you learn these basic things, starting with patho, moving up to signs and symptoms and assessment findings, move into common labs or common diagnostic procedures that are associated with the condition, and then lastly, any pertinent or specialized nursing interventions that go along with that condition, and you're good. Y'all, I just condensed down like 10 pages on hypertension into one page. And I actually have this document on my website if you go to drashrn.com. And there's, I've got it actually laid out for you how to make a sheet on every single condition that you have to learn, okay? There's a lot of information out there. I appreciate you guys coming on and letting me talk your ear off. If you find some value in this, let me know. Otherwise, I will let you go. I hope you have a wonderful Friday, and I hope you have a wonderful weekend. And I think my next topic is going to be on SMART goals. Everybody loves goals in nursing, okay? So you guys take care, and I'll talk to you later.